And we should be on. We are on, I think, with my buddy Yaron Peters from PT West in Woodland Hills, man. It's been a long time. I really appreciate you actually doing this right now with us. I've been thinking about since this whole thing started, you know, in the first couple of weeks, that I wanted to get you on and really kind of get a take for physical therapy and what's going on in that world. But before I get into that, how you doing?
Everything is going well. Everyone's healthy. We managed to keep all the staff healthy, which was important. You know, families healthy. As a matter of fact, I only think I know one person who has come down with this COVID-19. So at the end of the day, from a personal level, and they actually survived it, and everything's all good on that side. So aside from that, I mean, I feel like we're coming away with a win. It's not over yet, but things have been on the up, you know, which is great. So at least awesome. no real, aside from dealing with business stuff, no real personal pull downs, which is great.
That's great. I mean, listen, right now, I don't think anybody needs any more piled on the plate, right?
Yeah. Oh.
Really quick background for everybody that's kind of watching right now. We've known each other for almost over 20 years now.
Oh.
You realize that? So like when we were just talking earlier about, I actually met you through your wife. Your wife, Karen, was actually one of my very first clients ever. And that was back in my Bodies in Motion days, working out at that facility. And she and Adi were actually one of my first clients.
That's right. I forgot they both trained. That's right.
Crazy.
That's how we got to, that was the connection that we got with Yaron, was when we opened up in 2003. Karen was one of the first people that reached out to me and was like, hey, do you guys need a trainer? Do you guys need somebody to work with? And that's when Yaron came on board and started training over at Arena Fitness. So I would have to say, and I'm going to go out on, I'm pretty confident when I say this, is that you are one of the most successful Arena Fitness coaches in Arena history, with opening up PT West in Woodland Hills, which congratulations, 5,000 square feet, working with, how many physical therapists do you have working there?
So we have two locations, but our Woodland Hills location, we have 5, including me. And funny enough, with this coronavirus thing, we hired a full-time physical therapist the day before it became news. So wow. That was another challenge to take on, to say the least. But fortunately, he was a really understanding guy, and he still is, and we're all good. We're moving forward. So, and then our Lancaster location, which is pretty far away from here, it's about an hour. We have 3 physical therapists there. We have one main guy and then kind of a few part-timers. So they're both. You know,
I actually forgot that you had that Lancaster location. Wow, that's amazing.
That was my first job, and then I bought the thing from the owner. It was great.
That's right.
Yeah.
Wow, man. So you were traveling out to Lancaster when you first started doing this thing, huh?
Yeah. It was insane. I probably worked 80 hours a week for a decade.
Wow.
I mean, that's exactly why I have no hair. I mean, it's not even a genetic thing.
We all know that feeling, right? You know, at the beginning, you've got to make it happen. And so you grind. You're not counting the hours because it doesn't matter. You got to be there. You take patients or clients or whatever the situation is at all hours, under any circumstances, just to build the business.
So that's the only way to do it.
Good for you, though.
This world is too hard to make it to take any other approach.
Yeah.
Absolutely.
Thank you, man. I appreciate it. Well, I also got to give you guys love. I mean, you guys were there when I first started, and I'm sure there was a million ideas that I learned from you guys running your business. And, you know, fitness and PT, they're obviously very much related. There's a very close interlink. And so thank you guys for being a part of my journey, man. It's been an awesome one. And man, 30 more years and I should be retired by then.
Hey, Dad, we're proud of you, man. We're proud of you. I want to try to do something here, Joe. I'm going to try to grab the screen real quick. Okay. Cause only the host can share. Shoot. There was something I wanted to share. And it was a picture of you. You started working with us in around 2003, right?
Something like 3 or 4.
2004. But just to get a little background on, I'm going to end up reading this then. A little bit of background on Yaron. In 2002, Yaron Peters was a member of the University of South Carolina Gamecocks baseball team that made it into the college World Series final. Yeah.
Oh, yeah.
And not only did they make it into the World Series final, but this gentleman, this handsome ape here, was the SEC Player of the Year.
Yeah.
And so I had one of the pictures that I wanted to show, but I also wanted to read something.
Polaroid?
What's that?
Right now.
Is it a Polaroid?
Try it. Okay. Hey. Yeah. Right. Exactly. It was one where the guy had to hold the light and it exploded, and then they took the picture. Like that's how old it was. All right. So let's see here. Photos. I'm going to see if I can do this.
Oh man.
All right. So here we go. Here's one of them.
Ooh.
All right. So this is our guy. At the plate.
I don't even think the ball's landed yet.
Look at that. And then let me see if I can get, there was one more that I wanted to show because this I thought was really cool. So I found this thread, this forum, and it said, who was your favorite Gamecock to watch play in the last 15 to 20 years? And this guy says, Yaron Peters. He had the best year of any Gamecock, setting the single season record for home runs with 29 bombs in the season, as well as a single season record of 95 RBIs. Wow, and the guy below him says he was a beast in 02. So that's our guy right there, man. So he's not just
that was 2017.
That's right. That was 2017 that the guy posted that. So you are not forgotten.
That's amazing. Forgotten. I thought I was like completely old news from over there. I mean,
you're still top of mind, man. So anyway, but what's cool about that, besides the fact that we just get to brag about you a little bit, being SEC Player of the Year and 29 bombs in the season. How many regular season games do you have in college?
I think that year we played. I mean, so if you're that year specifically, I think we had 72. No, there were 75. I played 72 because I pulled a hammy somewhere in there for a few games. But I played 72 games that season, and normally it's something in like the 60 to 65.
Right, range. But you had the postseason. Postseason games. So if you hit 29 bombs in 72 games, then if you extrapolate that out, that would have been like 70 home runs in the major leagues over the span of a 162 game season. So your home run per game ratio was off the charts.
Off the charts, yeah. Anyway, we played in the gorilla ball era too. I mean, we played in the era where everyone was lifting like a football player. Bats that were legal then are no longer legal now. So, but it was. Anyway, I don't want to take too much credit away from myself, but it was. It's a different time now for sure too, though.
Yeah, but what's cool about that? So besides the fact that we just get to brag about you with regard to that, I think it's really cool. You were a high level athlete, and so I think that from the perspective of being a physical therapist gives you a somewhat unique insight into the way that the body functions at a high level, especially with athletes. So just wanted to put it out there that not only are you an outstanding physical therapist, but as a top level athlete, you've got a unique understanding of the human body.
Yeah, no, absolutely. I mean, I think the game led me to, in this direction. And I think you're right. I think the whole thing kind of completes my ultimate landing point, and definitely all plays a role. I mean, bottom line is that everything has to do with human function, human movements, biomechanics. They're all so interrelated, and it's nice to have that mentality, especially when we have an athlete here. I understand what they're going through. I understand what they're trying to achieve. Sometimes you got to put them in check, and sometimes you got to inform them on their body is their temple, and they don't quite understand that if they don't start learning their body, they're not going to be playing for much longer.
Right. That's an interesting point, because I've always said to people, because you know my background and all the injuries that I've experienced over the years with jiu-jitsu and everything like that. And I've always told people, listen, some of the hardest training I've ever done in my entire life is physical therapy. and really trying to understand how the body works on a much different level, at a micro level sometimes when you're trying to deal with an injury, and to try to come out of an injury sometimes, getting back on the field, getting back into your competitive sport. That's one of the hardest things somebody can do, in my opinion, over any type of boot camp or any type of like training camp that they go to, because it needs to be so relentless at that level. If you want to get back into sport and different things, the therapy just needs to be constant, and you got to be kind of mindful of your movements even outside of your PT sessions, and try to incorporate and kind of learn how to, depending on the injury, right? How that body works together, and try to do it. So it's really awesome work that you guys are doing down at PT West. I see that you guys are always innovating. You guys always seem to have like the latest technology, the latest research, and you're testing it and different things like that. I tell all my clients, hey, listen, if you're going to go, PT West is the way that you want to go, out in Woodland Hills, and try to get as many people out there as possible. You rehabbed Aaron Reynolds with his,
with the wrist. Cool guy. I like him a lot. He loves you guys, by the way. He loves you guys.
Oh, dude, listen,
I think does he work with your brother? I think he works with your brother, right?
He works with both of us, and you know, when that happened to him, it was the day of his birthday, and and he had just gotten a steel mace that we were trained together with, and he was so bummed because the doctor at the time told him, hey, you're not going to be able to do a push-up in minimum 12 to 18 months. And it just crushed him. And I was like, go see PT West, go see Yaron Peters. And how fast did you get him back in the gym?
Yeah, I mean, truthfully, and this is really, he bounced back really fast, but it's consistent with every patient. The more they want it, the better they're going to get. I mean, we're here every single day. And, you know, patient comes in here like very, very eager. We're going to match their like motivation with our motivation. And it's somebody really wants to get better, they're going to get better faster. You know, and that's the best thing, is that you got to come into it really wanting it. You know, but again, it's tough. I mean, psychologically, you know, there is a whole psychological component, you know, getting yourself together and realizing that accidents happen. That's why I have a job, right? I mean, nobody plans on falling down the stairs and breaking their wrist or whatever. Forgot how he got injured. But, you know, nobody plans on, you know, cutting non-contact and tearing their ACL. I mean, it's just, these are accidents. And, you know, once you kind of got past that point, you got to be full forward and fully committed. Once you're fully committed, you can, we break records here all the time as relates to like personal records on getting people back on the field at a certain time. And at the end of the day, yeah, it has to do with us, but it really has to do with the patient. Patient is like, comes here like hiring us, not coming here telling us what to do, but telling us what they feel. You know, we do involve them with the decision making, but ultimately, you know, they're hiring us for our professional, and they just got to listen and soak it all in. And then, you know, sometimes we have patients here for, depending on the problem, 2 hours. I mean, depends on what it is. Depends on how much detail we need to get into. And it also depends on how much they love it and how much they want to get back. And we don't necessarily push people out the door, even if their insurance doesn't quite pay for it. You know what I mean? We just like, if you want it, you know, I mean, but there's a balance. There's some people, you know, that you kind of have to say, all right, what you're doing is no longer effective. But then there's some people who really want it, and that guy Aaron is a perfect example of a guy who was like, I just started getting shape. I need to get back as soon as possible, and that's what happened.
Well, listen, I mean, like, you cut down what originally was told was 12 months not doing a push-up, and I think he was back in the gym in a matter of 6 to 8 weeks. Which was amazing. I was like, I saw him in the gym. I was like, what are you doing, dude? Why are you here? He's like, oh, Yaron got me to the point where I can come back in. He said it was a I'm like, sweet. And within, you know, 3-4 months, he's sitting there swinging, you know, a 35 to a 54 pound kettlebell. And now he's swinging the 70 pound kettlebell, no problem.
I mean, it takes a village, man. It takes a village. I mean, you need a good orthopedic surgeon to a great orthopedic surgeon. Then you need good PT, and then you need to follow it up with the right fitness, because if you don't have that 1, 2, 3 punch, what's happening is your gains are not going to last. And that's when people become disabled. Ultimately. Right.
Well, listen, with that said, I kind of wanted, the main reason I brought you on today was what does physical therapy now look in this kind of COVID-19 world for you? Because, we were talking earlier, you guys had experienced an initial drop in attendance, but now you're kind of back up to running full speed, right? For one of those essential kind of businesses that need to continue operating different things. What kind of things are you doing over at PT West for patients in terms of protection and safety and different things like that? And how do
I mean, we're doing a lot. I mean, what's nice is that we get updates from like CDC, and we got to follow these guidelines to make sure people have like the PPP and all the staff has the right PPP, and obviously someone's got to go ahead and buy them. And so all of these moves had to have been made, and they had to have been made very, very fast in order to be able to safely bring patients in. So what we first do is we do like a non-contact thermometer, step one, right? If they don't have a temperature, that's first gate. And then we have like an infectious disease screening that we do, like, hey, have you been in any, and this is actually something I can give you guys if you guys want it. You've been in, I'm actually reading off it right now. Have you been in any big crowds? Have you been, have you ever tested positive for COVID-19? Do you have fever? Do you have severe headaches, muscle aches, weakness, all of the signs and symptoms? But most importantly, I think the number one thing is like, have you been in big crowds recently, right? And if you can combine that with certain symptoms, you may not want them in now. That's something that I think people are, especially in this area, we're in like the Woodland Hills area, that people are pretty educated. They haven't seemed to look past that just yet. We haven't run it by anybody who hasn't been pretty informed. So we've been pretty lucky. But once they come in and everything is all good on that side, we have a pretty big facility, which we're spreading everyone out, must wear a face mask. All of the staff wears gloves all the time. Patients can wear gloves, we have them for them. And, we're obviously just paying close attention if they have symptoms or if they don't. One of the tricky parts is like now that this kind of part of the season, this part of the year is coming up, it's like allergy season. So people are sneezing because they have allergies, including myself. And you have to be sure, be smart and make sure to ask the right questions and just gotta make smart decisions and ask the right questions and be very bold. I had a guy, one of my patients, just like 3 weeks ago, I think it was Persian New Year or something, 3 or 4 weeks ago. He's like, oh, I'm going. I was like, what are you gonna do? He's like, well, I'm gonna go to a party. And I'm like, what do you mean you're going to a party? And he's like, well, yeah, it's Persian New Year. I was like, listen. He's like, I know that I don't look healthy, but I'm actually very healthy. I said, listen, if you go to that party, make sure you don't come here for at least another month. And basically, we're very transparent. And with age, I've become a little bit more blunt. And I have a responsibility. So I'm not just taking care of my own health, taking care of the health of everyone around me. And you just got to kind of be straightforward like that these days. I feel like like that wasn't okay. So then I think he took that pretty seriously, and he didn't go to the party, and he was allowed back, which was nice. But I made sure, like, my staff called him, like, did you go to that party? Like, you can't do stuff like that. So you just gotta be smart and ask the right questions and listen. And some of the most important things.
So you've got a pretty good system there where it's like gate 1 thermometer, gate 2 infectious kind of questionnaire. Yeah. And then gate 3 would be kind of like the sanitation protocols that the CDC kind of recommending to you guys.
Yeah.
What's the overall response so far? Patients coming into the facility, is it something that you feel? I would imagine that they feel really comfortable coming in with all those measures in place, and that kind of help out with everything too as well. What are they saying?
Yeah, I mean, they I think anyone who comes into to a new place for the first time is a little skeptical in the beginning. I think it's just kind of human nature. And they kind of look around, they kind of see what's happening, and they realize, we've spread all the tables apart. We, some of them who are, some of them ask us ahead of time, how do you schedule it? And what we've been doing is scattering our schedules. Like for me, my schedule is very busy on Monday, Wednesdays, and Fridays. And Tuesdays and Thursdays, I don't really see patients much. A lot of the other guys are busy on Tuesday, Thursday. Some of them do like 3.5 days. So we're very much scattered. We're making sure there's not too many people in the same room at the same time. But our setup is similar to yours. We got a big floor, like a big gym area with high ceilings. All that's really helpful. Another thing that we've adapted, which came from a suggestion from one of our patients who's also a ear, nose, and throat ENT surgeon, upper respiratory specialist, is that we got a mist humidifier, and we put we fill it up with water. It's supposed to be distilled water if possible, and we put just a little splash of like a cup full of bleach. And what it does is it basically kills the bacteria in the air, and it also creates an environment where you're kind of like when your house smells when it's just cleaned, someone cleaned the floor, it's just like that nice fresh feeling. So I think the combination of the visual as well as kind of how it smells and all these and our measures, we got these monster wipes that are like very like almost like basically ER level wipes that we're wiping down before and after every treatment, whatever someone's touching, obviously the tables. So we're very proactive, we have patients here who coincidentally were like post-surgical knee replacement, a week before this happened. If they don't come to us, they're never going to really walk well again.
Right. Well, that's another good point right there, because one of the things that I wanted to bring to light with people is how important it is to go to facilities right now, like yourselves, like PT West, and continue their rehab if they're in that situation. Because listen, if people are too scared to go to physical therapy or are assuming that physical therapy clinics aren't open, because nobody's open right now. One, I wanted to bring light to the fact that you guys are operating, you guys are an essential business, and it's crucial for them to receive physical therapy if that's the timeline that you're in. Because you can listen, if you stop your physical therapy simply because of this and because you're afraid of contacting COVID-19, you're also, it's like this risk reward type of thing. You might not understand all the safety protocols and how safe a physical therapy clinic possibly could be. And because you're not aware of all those protocols that are being taken place, you could affect your movement for life in a very negative way. Where, a year from now, listen, you come out of ACL surgery, you're not doing physical therapy right off the bat. That can affect the way you walk for the rest of your life.
Absolutely.
Talk about all the different just problems that can result from that. I mean, it's monumental, and it just stacks. It gets worse and worse.
Yeah. I mean, I think that's, I think with, in today's world, they're giving physical therapists doctorate degrees, and I think they're giving it to them for a reason. And I think it's to be the ability to manage situations like this, the ability to understand when is it time to refer a patient out, allowing, giving us the opportunity to work in hospital settings for, periods of time, to understand the medical part of it. Not everything is like sports, right? I mean, that's what we love to do. But you also have to understand the medical side of it. You have to understand patient medical history. All that stuff kind of plays a really important role. And there are patients, even if it costs us money in business, who I said, I don't think it's a good idea for you to be here. If you decide that you are healthy enough and your doctor thinks it's okay for you to be here, we can't continue. But I'm telling you right now that you fall into this vulnerable group. And, there's a responsibility that comes with it. And I think at the later time, those type of people will appreciate it and be back later. You know what I mean?
Absolutely. I think you're spot on with that. And I think that, Jonathan and myself will have to, I'd be surprised if we won't have to cross that road when it comes down to that point. Where we'll have to be kind of discerning, be like, listen, you may be healthy, you may be fine, but you're still in a vulnerable state, and we need to protect you and make sure that you're doing things and offer them out. We're lucky enough where we can offer out Zoom sessions and different things like that.
Great.
We can still keep people healthy remotely.
I mean, you guys can take the same precautions that we do. I mean, you guys are smart guys. I mean, you've been doing this forever. I mean, these precautions that we're taking is not neuroscience. It's kind of almost, it's not that hard, It's anyone can do it, but I mean, at the same time, it's pretty much a very similar situation. I think that, well, what was the situation with the gyms right now? Are they not letting you guys open? How does that work?
Right now, we're not allowed to actually open. And in some cases, I've actually heard of people, Leo from Results out in Sherman Oaks. I was talking to him really early on, and somebody came by from the city while he was just in his facility. He wasn't seeing anybody. He was just kind of doing things in there, probably just checking on the mail and different things. And they told him if they catch him in there again, they'll fine him and cite him.
Wow.
And he wasn't even open. So, and he wasn't seeing clients or anything like that. So you hear stories about that, and we just kind of, we're always going to fall into, we're in that phase where it's just like gyms right now are just not allowed to operate in the gym. You're a little different because you've been deemed an essential business.
Yeah, sure.
Because it's more, you guys are more on the medical side and things. But as far as an operational standpoint, you're exactly right. We're in the same scenario where we're going to have to take the same protocols and different things like that. And listen, afterwards, before we open, I definitely want to sit down with you and kind of go through that list that you guys are doing, because our businesses are so similar in that respect. And I want to have a collaboration of great minds kind of coming together and really doing this thing right and protecting the community. Listen, I've always said it from the beginning. The best way, and this is what kind of bothers me about the fact that gyms are being kind of curtailed to the back end all of a sudden.
Of course.
And I get it, because we get lumped into the same category as like the LA Fitnesses of the world and the 24-hour fitnesses. And
ridiculously unfair. That's ridiculous.
Yeah, it's not.
1,000 people in the room at the same time is different than a small club.
Exactly. But you know what? The city doesn't see it that way. They see gyms as, all one kind of category. And it's unfortunate too, because listen, our community, it's so important now more than ever to stay healthy, right? Like you got to stay fit, you got to work out, you got to move. Everything that is coming out with this COVID-19 thing, even for people that have it, what are they telling people to do? Don't stop moving.
Exactly.
Move around.
I mean, the bottom line is the fittest people and the people who are the healthiest, the people who are in an active exercise program are the ones who, if they happen to be unlucky enough to get sick and be next to someone they don't realize has COVID, then they have it, and then they have the disease. And then the fact that they're fit is the single most important thing that's going to get them past that. And
I came across a paper just in the last week or two, in which the study showed that physical fitness has protective measures against COVID-19, and it stands to reason, right? But there was a physician or a scientist, a researcher who actually conducted tests based upon scientific method and actually came to that conclusion. So there are protective benefits to when it comes to exercise.
Yeah, there's no doubt. I remember that actually I should give you guys this article from the New York Times that I read I was talking to another orthopedic surgeon about it, how by people who start a fitness program at a younger age and maintain a moderate fitness level throughout life end up having lower inflammatory levels leading to lower pain levels. Have you read that?
Yeah.
Familiar with that one?
I saw that.
Yeah, I saw it. And so what we were discussing when I was discussing with the orthopedic surgeon, I don't know if you guys know Eric Ferkel. He's a orthopedic surgeon at SCO. He's just like absolute genius. But we talked about how is this going to impact patients in physical therapy who come at an older age, let's say get a hip replacement because they fell and have never been connected to fitness prior to that. How are they going to respond? And the way our conclusion was, we got to take it like a lot slower and a lot easier with them. And I think that anybody who has this coronavirus disease could fall under the same situation. Like their body's not going to fight back if they're not healthy. It's kind of obviously.
Well, listen, I hope they figure this out in terms of allowing smaller studios like myself to operate, because the longer that we're not able to operate and stay open and offer that service of keeping people fit and keeping people healthy and keeping people's immune system strong, my fear is that it starts to put the community more at risk by not opening than the other way around, which is, you open and obviously no business owner wants to become a hotbed for COVID-19, right? So there's also that kind of fear for that, but there's just too much data on the side that staying healthy and staying fit is a bigger hammer to try to combat this thing than not opening up and becoming a hotbed. that is on the lower end of the risk when it comes to facilities like ourselves, which are smaller in nature. We're not going to pack 150, 200 people into a small little room, right? We're not a spin studio where we have like bikes side by side and we're running biking programs like that. Exactly. So, you know, it's funny because, and even with the physical therapy world, you know, it's like, I've got clients that need physical therapy right now alongside with fitness, right? They still need those two kind of working together to get themselves out and healthy and make sure that they're moving properly. So I hope that they figure this thing out. You know, in the meanwhile, obviously we've got, telehealth and Zoom meetings and different things like that we can offer out to patients, and we can always, you know, those people in more critical situations where they need physical therapy. We've got places like your clinic that's open, that's taken the precautions that's necessary. It's awesome to hear that your patients are actually taking to that and listening to your guidance and actually coming in and getting therapy. Because that's a huge thing for people long term. You know, the other part of that is, you know, I haven't talked to John about this, is, and maybe you can answer this for me too as well. You know, you go 2 months without having your clients see you, and you know, most of our clients, you know, our clientele, most of our clients were working out anywhere between 4 to 5 times a week. I feel like our clientele is at a higher level of fitness than most people kind of go around that would go to like an LA Fitness or 24-hour fitness, because we have that relationship, so they see us more. What happens to our training program in July, right? Do we have to take a much different approach? Because we obviously can't start where we left off, right? I'm going to assume that people have been sedentary for 60, 90 days, or doing minimal amounts of exercise. My fear is that we go back into the same training program in July or even June, and then we start wrecking people. You know, people start experiencing lower back pains, neck pains, shoulder pains, different things. What would you recommend for us to kind of take in as an approach when it comes to reintroducing fitness the same way?
The fact that you're thinking about that already is indicating that you've been doing this for a while. I mean, no rookie's going to come around and be like, oh, let's, you know, they're not even going to think on that level. So the fact that you guys already have your experience, you understand that, you know, rechecking, you know, when your client's mobility, and, you know, not only just getting like the subjective feedback, you're going to kind of have them move, and you're going to see, wow, you're not quite moving the way you used to. And I think that anything has to have somewhat of a scientific approach. You kind of test, you get them mobile, you kind of retest, right? And I think it's consistent with fitness too. You know, I think whatever program that person may be a part of, I think it's important to, you know, talk to them, say, hey, have you been sick? Have you not been sick? Get them through your movement pattern protocols that you guys all have been, you know, been using to this point. And, you know, it doesn't even have to be that complex. And then as they start working out, you can also use that as an assessment too. It's like a treatment assessment combo, or, you know, workout assessment combo, where you're seeing how they move. And, you know, it's just more of a gradual stepping stone. I mean, unless they've been getting after it on their own, which it's very hard to do at your house. I mean, without equipment and everything, all the motivation you guys supply and music and other people working out next to you, it's kind of hard to push yourself to that level. But, you know, unless you have been pushing yourself to that level, you are obviously going to have to take a step back and, you know, maybe reassess a few people at a time and kind of just see, you know, making sure they haven't fallen too far off. And, you know, that type of approach, which you guys have already so well trained to do anyways. I don't think you're going to miss too much of a step. I think it's just a matter of just getting them back responsibly. And I think you guys have a great, like I said, your setup is perfect. I mean, you guys have like high ceilings, a lot of room. I mean, you guys have a very good environment to allow people to move around safely. And, you know, you can get them athletic and not being stuck and confined in these little tiny spaces, which I think is the biggest fear going back into the real world. Is you got to really pick and choose your fitness facilities, right? You got to pick and choose your physical therapy clinics, right? You can't be in these small like dental cubes like you see at like the dentist. There's a reason why, you know, dentists are the last medical professionals are going to be allowed to open, because they're treating a patient in this 5 by 5 foot box and their mouth is open the whole time, you know. So think about that. So me and you, we have the opposite. We are, you know, we have face masks and we have a huge space. So like I said, everyone's got to be responsible when they come back. And I think it could be a smooth transition. It doesn't have to be that complex. I guess that's how scary it is, but it doesn't have to be that complex. It needs to be a gradual, smooth transition.
Well,
So with regard to that, just kind of jumping onto what Joe was saying, we know that a body that's in continual movement is a flourishing, growing body. We know that a body that is sedentary is pretty much in a state of decay. And it doesn't take long for the body to experience a significant drop off in levels of fitness, in levels of mobility, through being inactive. It doesn't take very long for changes to occur in the body. So what are the things that you would say are the most common things to keep an eye out for if we're making the assumption that at least a portion of the people that we normally work with have not been as active or active at all for at least 60 days? What are the things that you think would kind of be top of mind as far as looking out for from a mobility perspective, from a risk factor perspective?
I think that, the three, I look at when I assess someone just on a very general scope, the three main things that I look at are ankle mobility, hip mobility, and thoracic spine mobility. And the reason it's kind of very straightforward. Those are the areas that become the most stiff with inactivity, right? If your ankle and your hip is not mobile, you know what's going to get beat up? Your knee. That's what's going to get beat up. And if your thoracic spine is not mobile, what's going to get beat up? Your lumbar spine, which is your lower back, and your neck, cervical spine, and your shoulders. You're going to kind of create this, like when people are sitting here on the computer all day and they're like this, you can't kind of extend it. So every time you're trying to reach for something, you're getting that pinchy feeling. But by creating that thoracic mobility, you know, you're doing that opposite of poor posture while you're on the computer type of motion. And when you're sitting on the couch watching the news and, you know, whatever it is that you're doing, you're only facilitating that problem. And working on that mobility is just so important before you can consider like a serious strength program.
That's great. I mean, so one more question that I wanted to ask you is, because we had actually talked about it, you kind of touched on it. I think that this is really important for people to understand that aren't going to hospitals or seeing their primary care doctor. Is it completely necessary to get a prescription from their primary care doctor in order to get physical therapy, or can I just come directly to you to get physical therapy? Yeah, you can.
Yeah, so that's a good question. So basically, about 5 or 6 years ago, I believe it's been a while. There was a law, AB 1000, which basically indicated that people can. It's basically called direct access to physical therapists. So the state of California now allows you to come to a physical therapist and treat with him for 12 treatments or 45 days, whichever is less. Now, what we discussed earlier is that's the state of California law. Now, and their insurance company is a different thing. Those are two separate things. If your insurance company says, you know what, you call your insurance company and say, you know what, I sprained my ankle. Now, who's going to be a better person to decide orthopedically if your ankle's in the right place? Your general practitioner or your physical therapist? So I would say the answer is your physical therapist, as long as they've been treating for the last 10 years. Something like that, it's basically, we are considered what you call like musculoskeletal disease type of experts, So if it's a musculoskeletal problem, you didn't break your leg, you didn't tear a ligament, or you're unsure, we are trained to not only treat it when you come here, but we're also trained to identify when it's appropriate to refer you out. And that's kind of like why they are giving physical therapist doctorate level degrees, is they're teaching us how to read imaging. They're teaching us how to understand differential diagnosis. And so there, again, there's that responsibility of making the right choices. And so, but to answer your question, we can see patients if they come to us directly. Some insurances will require a physical therapy prescription from their doctor, and some will not. And I think the ones that do not are smarter because they're saving money, because you don't need to go to your MD for an ankle sprain when it's an ankle sprain. It's pretty straightforward. Wait 2 hours, pay $300 for him to tell you nothing in 5 minutes of seeing you, and then come see me, and then start that process all over again and finally get treatment. So I think the insurance companies are starting to figure out they can skip that first step. It's not a threatening issue.
So you're seeing more insurance companies actually go that route.
Yeah, they're adapting to it because it's saving them money. That's what they're all about.
Yeah.
First, they're in the business of making money. Then they're in the business of helping people. Let's be sure we got that straight.
Right. Yeah. Unfortunately, yeah, that's exactly how it's.
Yes, I mean, they're businessmen before they are.
Exactly. So one last question, which is kind of like this thought that I've had in my head, and you kind of mentioned it a little bit just a second ago, is, we're in this interesting time, COVID-19, and people staying at home and different things like that. Are you kind of expecting a spike in musculoskeletal diseases moving forward and over the next 6 to 12 months? Do you think that we'll see a spike, considering that most of us have been home?
You mean, is your question related to positive COVID-19 patients, or is it just in general for people just not being active?
Just not being active, just having to stay at home. So what happened was during the first couple of weeks, we had this thing where all of our Medicare patients, obviously most Medicare patients are 65 and older, basically just a couple came. I mean, we had like 95% of our Medicare patients pretty much were very, very concerned and quarantined themselves. But what we've actually realized is that them not moving for a month caused so much damage that they're dying to get back in now. So like these last couple of weeks, we've been starting to get much, much busier because of the very simple fact of, and this is my discussion with a lot of patients who are, 65 and older. So how did you feel? How were you doing? You're like, oh, I was going to the gym. I didn't have any pain. And then over the last month, I don't know what happened. I didn't fall, nothing happened. And over the last 6 weeks, my back started killing me. I started having knee pain. I started having, these are old injuries that because they were going to the gym on a regular basis before they've been quarantined, they were doing great. They didn't need physical therapy. But now that they've been sitting around doing nothing, they need us to jumpstart them. And so they're kind of starting to realize, they're in pain. They don't know why, but based on the subjective information they're giving me, it's telling me the fact that you stopped moving is literally the underlying reason why you're in pain. And I do expect to see that. And I do expect people to not understand why they're sore or why they're in pain. And the reality is half the time it's because they're just not moving. And just moving alone is going to prevent so much secondary, tertiary issues. It's ridiculous. That's interesting because I didn't even think about like old injuries all of a sudden kind of coming about that you probably experience in years, but all of a sudden, your knee is hurting or your ankle's hurting or something like that. And you're like, oh man, what the hell, where did this come from? I've been sitting on my butt for the last 6 weeks. I shouldn't be in pain.
Yeah.
But it happened.
Yeah, of course. I mean, you're sitting on the couch all day. I mean, how much spine compression is being created if you're not up and moving around? All of a sudden you have shooting pain. You're like, what is that? I've never had that before. The reality is you don't have to fall down the stairs to have that injury. You don't have to pick up a TV. It could just be too much sitting. Too much sitting is causing so much compression at the spine that those nerves are getting just the discs, the nerves are just getting beat up. And the reality is you just got to get up and move, man. It's just it's kind of sometimes that simple. I mean,
it is that simple. And I wonder if you would have any sort of minimum prescription that you would recommend for people. We're in unusual times where people have less access to the traditional kind of support mechanisms that they might use for exercise. They don't have this, like you said, the social support, being around other people, the structure, the schedule the guidance, the coaching, all of those things that really go into providing a good framework for people to be physically healthy from an exercise perspective. So people are, even those of us who have a high degree of commitment to being physically active, are maybe not being as physically active as we normally would. And people who have a low level of commitment to physical activity on a regular basis may be doing nothing at all. So sometimes it is just as simple as get up and move. But if you were to just offer out a general recommendation to the general population as far as minimum level of commitment to just moving, what would that minimum level be? I know it's not going to be an exact science, but what would that minimum level be, and what would the activities be, keeping in mind that there are fewer activities available for most people right now?
For sure. Like if you're like at home, kind of goes back to what we talked about earlier. It was the same question you asked, was like, what are what are the main things that you see that are limited when you're reassessing a person who hasn't been active? And I think it goes back to what we talked about before. I think ankle mobility, stretching your calves, getting your ankle mobile, working on hip mobility, and working on thoracic spine mobility. I think those are like the golden nuggets, man, of movement. And I think that, like, for example, on our Instagram page, we have a thing that we give to our patients that's already there. One of our employees, this guy Gary, who's a PTA, actually physical therapy assistant, absolute animal beast. He's always just putting just such good information up on our site, on our Instagram site. And he has this one hip mobility where it puts you through an entire movement pattern where it gets you ankle, hip, thoracic spine mobility in one big move. And we produce those movements in all three planes of movement. We do, sagittal plane, frontal plane, transverse plane movements. And the key is you're getting all three of those major stiff segments. You're working on that mobility. That's kind of an all-in-one approach that I would take. And I would really, really say, hey, these are the three things you guys got to work on a daily basis. They're not going to get you sore. They're just going to keep you mobile. And then once you do that and you follow it up with like a walk around the neighborhood type of thing, it's a great 1-2 punch just to keep yourself mobile, active, because that position of spine compression on the couch for 6 hours, excessive hip flexion, which we're sitting at the desk all day anyways, the forward neck thing. I mean, all of that is kind of corrected with just a walk, right? And all of these mobility exercises. So if you can really combine those two, that is probably the very minimum that I would say is required to keep someone feeling and moving healthy.
Awesome.
That is awesome. Well, listen, man, thank you so much for taking the time today to actually meet with us and talk about the therapy and things that you guys are doing over PT West. Keep it up, man. You guys are freaking rocking it out. I see you guys doing all the stuff on Instagram. I really appreciate just having this friendship over the years, man, and watching you kind of grow and being able to kind of get ideas from you and really kind of bounce ideas, even when it comes to these protocols that we're going to take in the gym. I'll give you a call later on to really kind of hammer out, that infectious disease protocol. I think that's great.
Absolutely.
More ideas on how that's actually being done from the patient side too, as well. But yeah, man, I love collaborating with you over the last 20 years. I've definitely bounced off a lot of ideas off you, and thank you so much for everything. But yeah, send my love to Karen and everybody there.
You guys as well. Yeah, man. Thank you guys for having me. And feel free, if any of you or any of your clients have any questions, you guys can always give me a call, hit me up. I'm at Yaron@ptwest.com. You guys can shoot me an email too.
Absolutely.
If any of your clients have any questions and are not sure what to do and just need a little bit of guidance, we're open to that. And we just got to keep everyone informed and got to keep making the right moves. And I think we'll get back to normal pretty soon.
I hope so, man. That's
gonna be a gradual process. It won't be black and white. It's gonna be that gray area. We gotta accept that gray area, that merging point. And but I can't wait to get back to real life, man. It's gonna be great.
Brother. Me too, man. Well, listen, I'll post your information in the comments section below for our members and stuff like that. So especially those people.
And if you have those videos that you were talking about with the thoracic, ankle, and hip mobility exercises, we've got a lot of mobility exercises as well. But That sounds like a good one. So if we can get that one from you, that would be a great one to post.
Yeah, for sure. It can happen. Absolutely.
Cool.
All right, fellas. Thank you guys for having me, man. Much love.
Good to see you, brother.
Much
Appreciate
love.
it.
Take care.
Take it easy.
Much love. Later, guys.